And I would like to say that I feel very happy to be here, and I would like to thank most warmly the Foundation Pierre Fabre, because this is a nice opportunity to be here. And we started working together in 2015, and we started our partnership. This was the start of a wonderful adventure, very exciting. And in 2015, the timing was really perfect, because in the AFD, we started kicking off with digital activities. We already had in our portfolio different digital activities, but we really started developing this cross-cutting technology and in our own organization. So now it's completely embedded in our organization. And in 2 years, well, when we started defining our ambition and our challenges, everything has started speeding up. And I think that today we are aware of the needs coming from the different countries, and also how important these challenges are for AFD, which is a financing structure and which provides our partners with funds. Now let's look into what we're talking about. So we know that WHO has said that this would be one of the first pillars of health and health development. So this is a pillar, I think, when we speak of funding partners, which means that we can feel more hopeful. Why? Because we can meet some of the needs
pour apporter des réponses face aux différentes mutations que connaissent les systèmes de santé. Donc il y a des évolutions démographiques qu'on connaît, notamment des croissances de la population en Afrique qui sont importantes, avec une population qui va être multipliée par 2. Et donc, comme on disait, un enjeu de massification de la demande de soins. Dans d'autres régions, on fait face aussi à une problématique de vieillissement de la population, et on est interpellé là-dessus, nous notamment
in overseas countries, but also in emerging countries, we have to face this new situation. There is, as I said before, a rapid spread of chronic diseases, and this is why we have specific financial constraints, which are present in most countries, but also in less developed countries, but also in countries we're working with, or we have been working with for some time. And this is why digital is probably a really, it's going to pave the way for new possibilities. I believe that if we are aware of what is going on, we have to take into account the economy of all these countries, and I think that digital technology will help us to allocate all the resources we need. It can either be true in the field of health, where we have telemedicine, where we pool all the structures and all the tools we have so as to avoid having people going to the hospitals. But we also work in the field of prevention, which is now becoming very important thanks to digital tools. So I would like to show you a map of Africa, just to give you a snapshot of what we have been doing with our portfolio in the last 2 years. Well, in 2015, we started some initiatives, and the first one was what we call a sectorial facility.
Et qui aboutit à la sélection de 3 projets. Donc au Mali, avec la mise en place d'un dossier médical informatisé dans une douzaine de centres de santé communautaires. Au Burkina Faso, avec la mise en place d'un système de téléphonie mobile
digitalized. We also have phones for different communities, and in Senegal we have a telemedicine platform which was launched and which also concerns what we call the health pyramid. As you can see here, the Ministry for Health in Tunisia has also required our partnership because they wanted to define new strategies for e-health, and also they wanted to design an investment program which started quite soon. And this is something, I think, which has been a kind of flagship. It's rather emblematic because it clearly shows what we can do in terms of information for hospitals, telemedicine, but also how we can develop an ecosystem, which is an e-health ecosystem. And with the Public Investment Bank, we have challenged it in Africa, where we have 2 winners for e-health, Kifmon, who has been a laureate last year, and Otreac in Nigeria, which is an e-learning platform, which is now now being developed in partnership with different universities in Africa, but also in Asia. And as you can see here on this map, we are at a crossroad because we have plenty of different possibilities, many projects which are there, and it's something we're going to have to develop. Are we going to be able to develop all these projects? Well, in Morocco, we have another technical cooperation program which is going to be launched. In Tunisia, we have to streamline the health care services, and also in the area of Abidjan, in the Ivory Coast, and we also have contacts in Senegal, where they have been trying to develop a e-health national strategy, and we have contacts with Lentille, which is one of the associations involved in this project. So if we try to face all these requests, well, to start with, we have all the public needs, which are massive, because at the wider scale, we have to see how can we organize this from an institutional point of view, what is the role of public authorities, how is regulation going to be implemented, how are we going to use all the data, which is going to be archived, and we also speak of specific investments, especially for information systems, which are going to be embedded in hospital networks, and the other new field, which is very innovative, and I think this is going to be interesting for digital reasons, is how can we support innovation? How can we develop these digital ecosystems? How can we adapt our own technical and financial offer and be able to help our startups in this specific field? Now, what about national policies and public policies? I think that maybe this is too early a stage to see what's going to happen, but we started working with Tunisia, and we know that there are some approaches which can be very exciting. For instance, we can either have what we call a multi-interministerial approach, that is to say, we work with different ministries, and I think that fund providers or funding partners can work with all these ministries. We have to develop new technologies, and we also have to make sure that from a legal point of view, we have the appropriate regulations. In some countries, we have ministries for health which work on their own in a kind of silo approach. They develop their own apps, their own strategies, and they're in charge of maintenance of these networks. But as they don't have the appropriate resources, well, then they fail. And I think that this is why we should have a more open approach and see how we can produce new accreditation norms, interoperability norms, which would help all these countries, all these ministries to work together. And as we have little time, I think that there's another important aspect we should cover. We have countries, for instance, we don't really know what they want or what they need when it comes to digital technologies and tools. This is why that we have to try to help them. What about the fundamentals? And fundamentals can only be defined if we know what their needs are, what their expectations are. For instance, in Tunisia, we have tools which help us to see what the needs are. For instance, we've been conducting surveys, and we wanted to know how they felt about all these tools. And then you can really start targeting what the needs are, what are the sites they want to implement, what are the projects they want to reinforce and develop. And I think this could be what we call a first demonstrator. So this is why we have to start working on less ambitious projects which are smaller, but we have different bricks adding one to another. And we also have to support innovation. This is another pillar. We have a large study which has been launched. So we know that we have to be more systemic in our approach. If we go and start a partnership with a country, what does this country need? What about the different companies they have? What about the entrepreneurial framework? There's a huge challenge in terms of education, in terms of learning.
Donc là, introduire des modules de formation en code, en TIC appliqués aux différents secteurs. Et puis, bon, juste pour parler aussi du financement, au-delà des concours qui sont lancés à travers Digital Africa ou l'Observatoire, on veut essayer de commencer à travailler avec les incubateurs, les accélérateurs, développer des lignes de crédit aux établissements bancaires de la place ou encore développer le capital risque. Et pour finir très rapidement, Dernier élément sur les enjeux pour l'AFD face à cette demande croissante qui arrive. D'une part, tout ça nécessite d'avoir des expertises très fortes en e-santé chez nous, de beaucoup plus travailler en transversal, et ça c'est assez nouveau pour l'AFD, le numérique nous challenge là-dessus. On a vu qu'il y a des questions d'enseignement, d'ingénierie financière, des questions de gouvernance, des questions de santé bien sûr, de travailler avec notre pôle numérique, donc vraiment mettre en place des équipes multidisciplinaires. Développer notre écosystème, donc nouer des partenariats avec des bailleurs qui sont plus avancés que nous sur le sujet, comme l'USAID, et puis avec des acteurs aussi comme la Fondation Pierre Fabre, qui nous permet d'être vraiment en veille. Pousser la recherche, c'est très important, et ça encore, c'est une initiative de la Fondation Pierre Fabre pour être en mesure de mieux évaluer la valeur ajoutée du numérique sur l'offre de soins, et quel retour sur investissement peuvent en avoir aussi les pouvoirs publics. Et puis, pour finir, développer l'ingénierie financière, comme on en a rapidement parlé. Je vous remercie.